Is Julia Brennemer, and I am the Community Partnerships Coordinator here at the Indiana Department of Health in the Division of Nutrition and Physical Activity. I'm so glad you all were able to join us today. We are going to be going through just our 2023 SNAC webinar series. If you're unfamiliar, SNAC is the State Nutrition Action Committee, and we've been going through this series to provide information about topics of interest that the group had expressed wanting to learn more about at our meetings and in our interest survey. So we are very excited today to talk about engaging leaders and anchoring community experience and voice. So if you all want to introduce yourself in the chat with your name and organization, and then you can tell us more about how you currently engage with community leaders and policymakers. And that could be at the city level and the county level or even statewide. We'd love to learn more. So we'll start with that as we get our presentation all queued up.
So Julia, I am here and I now have access. It says I can take control of the presentation, but if you want to do it and I can just tell you to go forward, it doesn't matter to me.
Yeah, so I will stop sharing and then we can see if you can share your screen with us.
Okay. Well, that's so weird. I could a minute ago, but I don't see where it is. So it seems to have, wait. Huh. Well, I don't, on my bar at the bottom, it said share your presentation or something, take control, but it went away. So do you want to just go ahead and
yes,
do it? Or where am I supposed to find it?
Right. Yeah, there should be, do you see the share button?
Well, I did just a moment ago, but then when you said I'm going to stop sharing, it went away.
Okay. I have your slides here, so I will just pull them
open
up.
Share tray. Wait. Yeah, I found it. Yes. Okay. Cool. Should I go ahead and just start it? Just let me try something. I'm sorry, I don't use
all is good, no worries. Let me know if you're still having trouble and I can share my screen too. Welcome everyone, thanks for joining us. We are just switching over to the presentation here. If you want to introduce yourself in the chat with your name and organization and tell us more about how you currently engage with your community leaders and policymakers, and that could be at the city level, that could be at the state level. We'd love to learn more of how you're currently engaging with your community. And then I can see the screen, Liz, so that is great. And if you and Annie want to go ahead and introduce yourselves and get started, I think that sounds like a good plan.
Okay, and let me just ask you one last question. Are you seeing it so it looks like you're not seeing my presenter slides, correct? You're just seeing. Okay, great.
Yep, we're just seeing the regular presentation. All is good. Thanks, Liz.
Okay, so now just, oops.
It did move forward, so I think you're good with that.
Yeah, but the weirdest part is I can't see the, wait here. All right, okay. Hi, everybody, sorry. I'm Liz Grenat. I'm the Executive Director of Community Justice and Mediation Center, and our organization 3 years ago received a wonderful grant from the Robert Wood Johnson Foundation called Community Voices for Health. And so I'm here today to to really kind of talk to you about the project, but in particular, to really talk about the role of and getting everyone thinking about how to engage leaders and policymakers so that we can have better health outcomes for all the folks that you all are working with. So appreciate the opportunity, Annie.
Yeah, good morning. I'm Annie Eakin. I'm a community wellness coordinator in Lawrence, Monroe, and Brown counties. And I have had the pleasure of working with Liz, the Community Voices for Health, and everything we're doing moving forward. So Liz, I think you're going to start with the presentation.
Yeah, great. Yeah, so just to sort of focus on this, we're a CJAM is a community mediation nonprofit here located in Bloomington, Indiana. And the role that we play in our community is to help people solve problems. We do work in the restorative justice field, but essentially what we do is really create spaces and processes to help people come together to really solve problems. And we do that at the individual level with individuals or small groups of folks that are having a difficulty moving forward. But then we also, in the past few years, have started doing larger sort of what we call public engagement opportunities. And this grant afforded us the ability to really learn how to be more effective at doing this kind of work. So it was really exciting. The other thing is, just to tell you, when we actually applied for the grant, I didn't think we were going to get it. And so, it was so highly competitive. They only picked 6 sites around the country. And so we were really honored to be one of those sites that got chosen. And the part of the focus of this grant is really was to meet people where they are, to really use best practices around, engaging with people and getting people involved. And the grant launched on the day that the country shut down from COVID. So there was a lot that we had to do over those 3 years to sort of change our processes, adapt to what's going on. But I think in the end, it really provided some real opportunities to really maybe strengthen the engagement. But essentially, Robert Wood Johnson was interested in having communities, either statewide organizations, or we were the only grant that was doing a countywide process that then would have the ability to be scaled up at the state level. But essentially what they wanted communities and organizations to do is figure out how we can strengthen engagement, especially from marginalized populations, when in terms of policy decision making, because we all know that when so many of the issues facing our communities more disproportionately impact folks that are considered underrepresented, marginalized folks. So how can we do that more effectively? And how do we build this system that not only engages people, but gives opportunity for underrepresented folks to interact with decision makers, policy makers, in a way that really influences the outcome of those policies? And another part of the focus of the grant was, how do we then also, strengthen cross-sector collaboration? And sort of an underpinning is, how do we use community engaged research to do that? So it was a huge thing. It was only, a 2.5-year grant. Very ambitious project, started at the beginning of COVID. And when I kind of sit back and think about what we did accomplish over this time frame, I'm really kind of excited to see what we were able to do, because it is, a very, multi-tiered process. So, and today what we're going to do is sort of I'm going to give you a broad overview. I'm going to go through a lot of slides really quickly, but then we're going to focus on that role of how we really worked with the local decision and policymakers to ensure that this, right-hand side of the triangle, that we really were, engaging in ways that were going to make a difference. So essentially, what we are trying to do through this project is collectively broaden the understanding of our community around the issues related to health, how we center equity and voice in ways so that decisions are made and improved, and then create those pathways. And then ultimately, this is really a project that's looking at trying to change systems and build infrastructure so that, once this project is gone and done, that we will be left with better ways to make these decisions and improve health outcomes for everyone. There were lots of project partners, and we were really benefited a lot from the expertise and leveraged the Indiana University. And I hope many of you have, maybe colleges or universities that you might be able to partner with in the work that you're doing. So that was really a wonderful opportunity. So I want to define a couple of things. Public engagement is about relationships between residents and the institutions that serve them, and also about the relationships among residents. So that's sort of the baseline. They are activities, and what is public engagement? Activities by which people's concerns, needs, interests, and values, and that's what conflict resolution is all about, is helping people identify and their interest and concerns, and that those are incorporated into decisions and actions on public matters and issues. And it has a lot of stuff that I'm going to talk, different elements that I'm going to talk with you about today. There are basically three types of public engagement, and this is important to sort of understand this framework of working with local leaders. There is the conventional engagement, which is really sort of what we exist in now, which is more top-down and relatively transparent. And then there is thick engagement, where there's more opportunities for informed interactions between the decision makers and the public. And a lot of the work that we did falls under this thick engagement bucket. And then there's thin engagement, and those are the different ways, other ways that people can connect and give their opinions, like surveys and other kinds of opportunities that don't take such an intense investment of resources. And then in looking at conventional engagement, or at sort of the local decision-making level, is really what we're dealing with now. So the current system is in Monroe County, and for those of you across the state, some of you may even be in counties where you aren't even afforded necessarily the opportunity, when decisions are being voted on at the city and county level. In Monroe County, we are able to come and give 3 minutes at the microphone, so we can give public comment. But there's no discussion outside of what the agenda is and what they're voting on. It really is easy to disrupt, and oftentimes there's a lot of tension, and it's a lot of folks sort of expressing very strong opinions and not about what they want that elected official to do. And so it's really inefficient, and oftentimes it's too late in the decision-making process for change to happen. So then I want to talk to you sort of about, we had sort of 4 main process design elements that sort of guided our work. And the first one, and I'm sure all of you have seen sort of some variation of this, and this kind of gets to this participatory engaged research. So along the process, as we were developing the elements of this grant, we really, at every step of the way, tried to think how we were informing, consulting, involving, collaborate, And now we're sort of getting more to the empowering stage of the involvement of the folks, the stakeholders that were involved in this. And this was really important because so much of what happens now in policy decision making is this at the lowest level of public engagement, where they're informing or they're maybe just asking for an opinion. But in terms of the involving and collaborating and moving towards solutions, oftentimes that then becomes the purview of the people in power. The second process design was, how do we develop processes in Monroe County for really consistently building the capacity to engage these policy and decision makers and the underrepresented folks in our community? So lots of our effort was designing ways and trial and error, and again, using the input from everyone that we were talking to and interacting with to sort of inform how we were moving forward. And this took lots and lots of effort and continues. This is probably the thing that is the most challenging to do in an ongoing basis, because it has to take constant vigilance to ensure that we're finding those pathways and we're eliminating barriers and we're making progress. So that was process design 2. Then the process design 3 was, how do we, again, strengthen existing decision-making processes? And this gets to more of the thick engagement that I just talked about. So the first thing was, we wanted to include dialogue. And so as we look at wicked problems and issues that are, you know, when you look at the health disparities between underrepresented folks and folks that have a lot of resources, you know, this is a wicked problem. We know that health outcomes is not just related to behaviors and access to healthcare, but all those social determinants of health, which are, you know, you all know about that. And that's the work that you're doing every single day on the ground with, you know, trying to eliminate food insecurities and disparities there. So in terms of understanding the problem, once we have, you know, identified who those stakeholders are and who are the folks that we needed to bring that we needed to bring to the table, what's important about this piece is that it really helps a community or an organization or the government really identify the issues and begin to frame them more clearly, so we really understand what's impacting and what's important. And our process that we use in this dialogue and deliberation process, public engagement, is not presupposed. So we really want to open space up for people to really say what's important to them, not get them just to weigh in on a issue. So we spent months and interviewed and held small group discussions with hundreds, you know, over 100 folks were involved in some of these small group stakeholders. And we really, you know, asked them 2 basic questions. Health depends on many things. What's important to you? What's important to you and your family? And what do you want your community leaders and decision makers to know? So that's sort of this framework, open space, safe space for folks to really share and be asked to give their input on what's important to them. Then the second part, and this is the part that is the hardest for communities to do. It was the hardest part in the work that, you know, we did. And that's then, once you have identified the issues, begun to frame the issues, then what you do is you want to bring people together, share what we've learned, and then really go about the process of moving towards solutions. And this is where it gets challenging and and much more difficult. And part of what this does when you bring decision makers together and citizens together to work together to develop, to deepen the understanding of the problem and then work together, it really creates a different dynamic, and it provides opportunities for some really creativity, collaborative problem solving, and it also helps people understand how difficult this can be. Again, we ground people in the experience. Like, so when you present the different issues, how do you relate to those issues? What's important to you or to your family or those close to you? So again, grounding it in the personal experience. And then deliberation really is, it's giving people the opportunity to work on a problem as if solving it is up to them. And then you talk a lot about priorities, what it would take to get started, questions that maybe haven't been asked or need to be asked, people that aren't at the table, who needs to be involved. We also do, we get people thinking about what assets already exist in our community to build upon. And then the two hardest things to do is what might we need to give up if we truly are committed to making these things happen. And that's where decision making gets challenging and difficult, but also when you give people that opportunity, it gets them really thinking more deeply. And then again, what's important is that it isn't just what do we want others to do? What do we want our elected officials to do? Which is so much of what, when you're advocating for something, you're asking your elected officials, to kind of solve the problem often and get frustrated when the problems aren't being solved in the way that you want them to be. So this really, we really tried to get people to think about what can you do as an individual to make this happen. And that kind of goes back again to the aims of this project, is that we want to raise the understanding for all folks, and we want to mobilize for action. So that's sort of the process design. 4 is then, and again, it goes back to that triangle, then how do we strengthen existing decision-making processes through enhanced cross-sector collaboration? So this idea of the group that you have that meets here quarterly is an example of why it's so important that we understand and we can learn how to work more effectively together. And as you know, every community has so many different groups of folks working on different things, and how do we align that work more effectively so that we're all sort of going in the same direction. So in terms of our timeline and our stages, we spent a lot of time in the beginning, and this is really important, especially with big, hairy, difficult to solve problems, is learning and understanding the problem. And what we called it was an engagement scan process. And so it included looking at health outcome data, and looking at case studies around public engagement, what was happening, identifying. So we kind of used two lenses. What are the emerging health concerns? What are people's impressions of how decision making is working now? And then who needs to be included in these discussions? So we interviewed over 70 to 80 people. We used a snowball kind of effect. At the end of every interview, we'd ask somebody, tell us who we need to get to next, so we could begin to identify who needed to be at the table in our community, how we were going to engage leaders in that process, and how people felt about decision making currently in our community. Then out of that, all of that information, and we were doing it at the same time, we really wanted to figure out, okay, how do we build effective governance structures for this initiative so that we can ensure we're adhering to best practices of public engagement and really involve and engage folks along the way. So we created another complex thing. We had a steering committee, and that was a group that really led was a lot of the grant partners with some additional folks with expertise and diversity. And they were really involved in the month-to-month operations of executing the things that we needed to execute for the grant. But the thing locally, then we created this advisory council. And at first we had an idea of it being much smaller and a little bit more targeted. But as we got feedback from folks, from elected officials, from individuals, from allies of underrepresented individuals, from members of underrepresented communities, we decided that it would be important that this advisory council represent sort of a cross-sector collaboration of participants. So we had 2 county council members, 1 county commission member, we had someone from the mayor's office, we had 2 city council folks, and then a broad spectrum of community leaders, allies, and members of underrepresented groups. So we ended up with an advisory council of about 45 individuals. And that is the group that we worked with throughout the process to help guide and support the development and engage and mobilize. Then we moved into the dialogue sessions where we, again, targeted those underrepresented groups. And these were like stakeholder groups. So we really wanted to create safe spaces. We began that process of identifying what those issues were around health and what they wanted their local leaders to understand. Once that happened, and to underscore the role that the elected officials played in these dialogue sessions that were members of our advisory group, some of them even became facilitators of the small group discussions and/or note takers. So those members of the advisory council were involved in the process of developing these questions and then helping to support the implementation of these small group discussion sessions. We had other ways that people could give feedback too. Tell us your story. We did surveys, photo voice. You could have an individual interview if you didn't feel safe coming into a group setting. And so we or had limitations or barriers. We had to do a lot to eliminate barriers, and many of these really were almost all except for 3 with groups of disability, people in the disabilities communities. These were by Zoom, and it was partly related to COVID. But we were creative in actually hosting some sessions in person with masks and lots of social distancing through the help of all of the allies and partners that were involved in the advisory council. Then we moved to the deliberation. Okay, here are these issues. Now we're going to move to solutions. At this point, the way that we used our advisory members who were elected officials to help help do outreach, and we invited all of our city council, all of our county commissioners and county council members, and folks from the mayor's office to attend these sessions. We wanted to have at least 1 county and 1 city representative experiencing what it's like to problem solve in a different way versus that 3 minutes at the mic, or hearing from their constituents by email. And so I'm really excited that all but 2 city council members participated in these deliberation sessions, and those were due to they were signed up and something happened and they weren't able to attend. So that was pretty amazing. And then we also, because we have these 2 tracks, how do we engage with the folks that need to be at the table? And then how do we really build and work with the elected officials? So after everyone had had this experience of going through our process design elements. We then brought our government leaders together for a dialogue and deliberate 2 sessions, and I'm going to highlight that in a moment and tell you a little bit more. Then once we did a deeper dive with the elected officials, we had our beginning deliberative sessions. We generated a lot of solutions. Then we really worked at, okay, what do we do with all this? We can do this alone and we can go out and we can share this information. But what's important was that at the same time, our Monroe County Health Department and IU Health were doing their CHIP planning process. And so we had members of the Monroe County Health Department and IU Health that sat on the advisory council. So together we decided, and Annie's going to talk a little bit more about that. Stage 7 was then sharing the results, and that's important along the process. Is so often, people give their opinion, but they don't know how those opinions are used, or did they go anywhere? Did they make a difference? So, this part of, and we're doing this now. We did it along the way, but we're doing more of it now. And then really the next steps of where we are and what we're going to be doing, which is really exciting. Our continued work, and talk a little bit about that, but we have the advisory, it's Community Voices for Health grant phase 1 is ended. Robert Wood Johnson gave us a little bit more money to continue these efforts. And so out of that, our advisory council said, this is something that we have to keep this going. And so we renamed ourselves Monroe County Health Equity Council. And then there's continued work that we're going to be doing with the governments. And then we're going to continue to work, and so it's going forward. So that's really sort of the steps and the stages and the process. And so I'm going to start with just giving you a little bit more information on the work that we did with the leaders, this drilling down more deeply. As I said, and we worked with our advisory council members to design these 2 sessions. So now we really wanted to deepen their understanding and awareness of the process. So the first session, we focused on, identifying the issues, sharing information, and then providing education. So we talked about all these things that we had heard from people about public engagement, and some of the comments were frustration with the divisiveness, feelings that, people were being drowned out by the loudest voices in the room, challenges with how to really reach out. Everyone sort of said this is frustrating because how do we do it? Too many silos. A lot of people talked about the lack of trust in the leaders and the political process. And there was a lot of discontent there. We then shared what was emerging, what we heard about the health concerns from underrepresented folks, and we really wanted them to know what we were hearing collectively. And then we also then shared positive stuff because we wanted to let them know that, and we did this through surveying and through the questions that we were doing through the engagement scan interviews and then the small group discussions. There was still such a strong belief that it was important to do this. The folks in the underrepresented communities, many of them said this is the first time they had ever been asked for their opinion and how important that was. And they wanted to be part of the solution. And, there were so many opportunities. So we wanted to frame for the elected officials that there was hope. And especially from that standpoint of the lack of trust in our elected officials and how this was sort of beginning to build that trust. And then we shared some really capacity and infrastructure stuff. It gave them a lot of resource materials, and we used one of our technical advisors who's an expert in this kind of advocacy, health advocacy and public engagement. She came in and talked about 3 ways that local government folks can build and strengthen their capacity so that they get better at doing this all the time. And we provided that information. We then, and at that meeting, that was a meeting where we invited the city and the county elected officials to come together, and they were together as we presented that information. The second meeting that we did with them was more dialogue and deliberation now. And so for this meeting, our members of the advisory council, the elected officials, said we need to break into our 2 groups. Our work is different. The way we make decisions is different. And so we brought them together and kept them in a full group, but then they went into breakout rooms via Zoom. And again, so this was framing the problem, or framing the issues and solving the problem. So we wanted to be sure, again, this is an example of how it's so important to give feedback back to people when they've given input. So how do we build trust? These were the questions that they came up with in a survey afterwards. They identified how they don't know how to reach out to underrepresented groups. They wanted to know more about what it would take to be successful. How can we have better coordination? How do we develop trust? How do we keep the principles and practice of public participation alive after a statute is passed? You know, they said it's really easy to ignore those things once they do all this work. They had a lot of questions about health and all policies as one of the frameworks, how to support it. And then really, how do they manage the impact of the state politics and statutes and how they interact more effectively with that. But essentially, what was so great about this experience is that they were getting, and the feedback after the second session, they were getting an opportunity to talk differently and just think about their roles, which very rarely happens, and in a way that felt supportive and not contentious and not divisive, and really getting them an opportunity to think. And they said they are so busy all the time that it's really hard for them to think about how they make decisions or what's important. And I thought that was really exciting. And then, you know, we really wanted them to drill down on, okay, so if you've heard all this, we've given you this information about ways that you can strengthen your ways of work at the local government level. What's it going to take to move forward? And so when we broke them into the small group sessions, we had 3 prompts where we said, talk about health and all policies. These are some of the, what's your first take? How might this impact equity, health equity? What challenges might emerge? And if you wanted to take action, what might have to, what might those next steps be? And so, and both the city and the county groups did that. And again, it was really interesting to see the feedback after this meeting. Then we provided a report to them that summarized their questions, their potential action steps, and then we gave them the opportunity to say, are there ways that CVHMC might help you do that? And so as an example, the county commissioner said that they were very excited about learning more about health and all policies as a way to structure their decision making, and wanted more support. And they continue to sort of work on that a little bit and continue at times to ask for more input. But that's an example of sort of what came out of that. And then I want to kind of turn it over to Annie and talk about the cross-sector collaboration and why that this was important. So after we'd done all this work, what's the there? And so because, I'll let Annie, take it away, but this is sort of what we did then with all of this information and how we worked on the community health improvement planning process. Annie.
So this is a very exciting project that I'm happy to be a part of, and I just thought I'd explain a little bit about my involvement, and that is that as a community wellness coordinator, we work on policy systems and environmental changes in our counties, and I think the hardest thing for us to work on is policy changes, and that's why I'm really excited to be a part of this, is because I can work on something that's very challenging and then help spread the word and affect my community and help others learn more about it. And so I got involved in the project as, I think, a community member, because I also live in Monroe County in Bloomington. And I did an interview and then suggested another person and another person, and that snowball, like Liz was talking about. But then I was asked to join the advisory council. And I think I'm considered an ally, and that I have a lot of connections, as most community wellness coordinators do. We have a lot of connections within our communities, so we can help network and get people involved. Let's see here. That's kind of briefly about my history and background with the project. So the next part here, collaboration for action and alignment. Kind of within the same time period, the Monroe County Health Department and IU Health was working on their community CHNA community health assessment for Monroe County, which they go through every 3 years. And the two entities have been doing this, and I'm sorry, the city of Bloomington as well. The three of them do this together every 3 years. And I was a part of it in 2019. At the end of when they were starting their CHIP community health improvement plan. And so since they were starting to go through this again at the same time as this Monroe County Community Voices for Health project was happening, we all kind of were like, this is a good opportunity for collaboration, and because they were operating in the same spaces. So as Liz put here, they created MOUs to share the data, created focus groups and focus group questions. And I think this is really, really critical to the progress that we're making in Monroe County for health equity and equity, getting underserved voices heard, is this collaboration with creating these focus group questions and focus groups. And so I remember being in the CHIP work group saying, hey, like, you're going to do your CHIP think tank at 12 o'clock at Switchyard Park. It's not a good time of day, a Friday afternoon, and it's not very accessible for a lot of people. So then we decided together that we would do these CHIP think tanks, and there were 2 of them, and they were at different locations, different times of day, different days of the week. The one in the picture here was at a community center in a low-income neighborhood on a Saturday afternoon. So we hope to just be able to attract more underserved voices or underheard voices at these think tanks, as well as all the people who had been involved in the past. So it was a co-designed meeting. We talked about it. These were boards with the different things that came out of the CHNA, different issues that we were focusing on. We all got together in the Community Voices for Health project, or the CJAM, helped to facilitate these meetings. So there were volunteers at the meetings. I was at that one volunteering to discuss one of the topics. And so all the individuals who came self-selected a different topic. And then after some discussion about it, we all kind of went up to these boards and put sticky notes on them as to what we thought was, each individual thought were the most important topics for the community to be focusing on moving forward into the future. So it was really a really important step in the CHIP, and because it got so many underheard, not so many, but it got a number of people who hadn't been involved in the past to be involved now, and that are still involved in the CHIP, the Community Health Improvement Plan. So after the think tank, and this document right here is a really, really great document that we keep sharing the image on the slide, and it's on the Monroe County Health Department website, as is all the information about our CHNA and the Community Health Improvement Plan. It's on our Monroe County Health Department website. And so after we were able to kind of have those think tanks and then vote as a community on our most important issues that we wanted to work on, we ended up coming out with 4 different areas, and 3 are listed here because the 4th one was housing, and working with affordable housing in our community. And since we have a coalition already working on that in Monroe County, we thought, let's not duplicate, and we're going to drop that one because there's already an agency working on it. The Heading Home Project is doing that. The other 3 are now going forward in action teams for the Community Health Improvement Plan. So we have behavioral health and substance abuse, which is being led by IU Health. Poverty and navigating social services, I'm leading that group. And then we have inequity, discrimination, and bias. Again, these were 3 different areas that were voted on in our think tanks by the community members to move forward and work on. And that now we have a number of those people working on each of these different community action teams. So beyond that, we're now working with Community Voices for Health, CJAM, and exploring collaborative grant funding in order to support the work of the 3 different action teams moving forward. So as somebody who's been involved in Community Voices for Health project and the CHIP, it's really been a really strong, successful collaboration to involve members of our community who hadn't previously been heard, because there are people out there who want to be leaders and they just need to feel comfortable and valued and get a sense of trust in order to have that voice be heard. And that was all developed through a lot of the work that was done in the Community Voices for Health project. What's next, Liz? Do I have another slide? We can talk forever about all this. I think that was the end of my slides. I think, but I do believe Liz had some more. Yes, is this me too? Why diverse voice important and health policy are important decision making. So I actually think that if you want to move to the next slide, the stats on the next slide show why it is really important for decision making. And so some of the numbers we have with the Monroe County Health Needs Assessment in 2021. The next slide, Liz, number 34. That showed that they collected a lot of surveys in the previous health needs assessment, but the information from the demographic they were collecting was 93% white, 74% female, 97% had health insurance, 83% had someone they thought of as their health provider. So that was a very specific population that that was being heard through those health needs assessment surveys in the previous health CHNA. And so that's what all the work in the previous 3 years was focused around, was those 780 surveys, which is great. A lot of feedback was focused on those demographics, of the feedback from the people in those demographics. So on the next slide, though, it'll show you now what, with that Community Voices for Health community conversations, we changed the demographics. And so our current community voice, CHNA CHIP, is now encompassing these 4% Asian Americans, 8% Black, 4% multiracial, 33%. So the demographics have changed because of the involvement of the Community Voices for Health project, those think tanks, and incorporating other voices that hadn't been heard in our previous CHNA's community health needs assessments. So, and that's really important.
Can you
Yep,
hear
go
me?
ahead, Liz.
Well, I'm sorry, I was having, I had some technical issues there. One of the things that I think these two slides, I have been showing these slides to different folks, and in different venues, especially people that are in power. And these two slides really help somebody understand the difference of why it is so important to do this. And, just the difference between folks who, all have insurance and are well educated and make a lot of money. What's important to them? If this was the only input, and not that the health improvement plan takes in a lot of other things, but you can just see the difference between, when you don't have a lot of stuff, what's really important. And so it really helps to, to coalesce that. I think the other part that was really cool about the CHIP planning process is after the think tanks, we members of the planning team and made presentations to various governmental units and nonprofits in the community to say, okay, here's what happened, because in the past, what's ended up happening through our health improvement planning process, it usually ends up being the nonprofits that work in those fields that do all of the work. And so again, we want the whole community to sort of understand that this should be the plan that we're all working towards to improve the, benefits. So I thought that part was really, I know Annie did a couple of presentations, got really interesting feedback. So next steps, kind of tell you where we are and what we're doing. As I said, there was a lot of interest in continuing this work. So Annie, why don't you talk a little bit about the Health Equity Council, where we are, and then I have one last slide and we can open it up to questions.
Okay. Again, I just feel so passionately about the work that we're doing. And so the Monroe County Health Equity Council is the continuing organization out of the Community Voices for Health project. I am right now one of the co-facilitators of the group, and we just met Monday night, and we've been meeting monthly, and we're really trying to be intentional about forming a group that is that makes an impact on our community and bringing the underserved voices to be heard to the city and county politicians or people who are making decisions about policies. So in fact, I actually just clicked on an email I'm working with, or not I, but Randy Rogers, our United Way president and CEO, sent me an email and said that I think it's so critical, and the more I learn about the project, the more value I see in it every day. So it's really cool. We have different community leaders in this group as well, but we also still have citizens who are participating in the group, and one of our greatest partners in the group is an individual who lives in our Bloomington Housing Authority subsidized housing, and she says it herself. She says, I quote, "I am a poor person advocating for poor people." And so those are the people that we want to have a part of our discussions and a part of our group, because they build trust in us, and then also within their communities. Okay, so I might have gone off the rails there.
Great. No, that was great.
Okay, go ahead. Do you, Liz?
Well, I guess in a way too, we're sort of redoing the process we started at the beginning of Community Voices for Health. We're now really recreating with our community and that sustainability piece. And so there's going to be a lot of work that we need to do to really make that structure that we're talking about. So one of the things that we really, we know where we want to go. We have elected, again, we have our, elected leaders that are on this Monroe County Health Equity Council. But what we still need to do is find those linkages. We need our governments to commit to collaborating with us. So that's the work that we're going to continue to do. We have one subcommittee that we just formed that is, how are we going to legitimize this process so that our elected and government officials earlier in decision-making processes are going to think this is when we need to involve community voices for health, or Monroe County Health Equity, and we need them to mobilize, and we need to hear from the disability community or people of color, blah, blah, blah. So those processes is what we're working on. That's the stuff we're working on going forward. And it is just so exciting. And Annie, I'm thrilled to hear that the United Way guy just sent that to you. It's really beginning, people are beginning to really understand and see the vision, which has taken 3 friggin' years. To work this work takes so much time. The other thing I just want to mention, and then sorry, you guys, this took longer than I don't know. I did it faster in my run through. So, but anyway, we have put together this great toolkit that outlines all of those phases and stages and has tools and spreadsheets and guides and training guides and suggested questions. So if any part of this project resonates, and even if there's so many things here that apply for just the work that each of you are doing in your own individual organizations and how you might think about that in terms of including more decision makers in what you're doing and more diverse voices. But this is available, and then Annie and I are willing to, talk more about any one of these different phases and modules. I could probably talk all day on this because there's so many elements. So I'll stop there. Thanks. Now, how do I stop my sharing? Or am I still sharing?
Yes, there should be a little X in that white box that you can click. But thank you so much for sharing about your project, and we'll open it up. We have time for maybe 1 or 2 questions if anyone has any.
Hi, this is Christiana Verismo with Purdue Extension. I was just wondering, how often is that grant that you applied for available that you got maybe 3 years ago initially?
Yeah. Well, it was a one-time grant because it was conceived by the foundation as capacity building. But I think that they would, so they may end up, as I said, when they got done, they told us these were going to be non-renewable grants. And when they got done, when we finished, we wrapped up officially in November, the foundation came back to us and said, we really want you to continue some of that work. And they gave us some additional money. But at this point, I don't know. But I would, that there are any specific plans, but you should always just look at the Robert Wood Johnson, because they are, so much of what they do is in that policy arena. And if you thought you wanted to start something like this in your community, there are part of some of the resources that we are developing are because we're wanting to find funds to support these continued efforts. I can share a few things with you, but even starting locally with your community foundation might be a start. But I do have some grant resources that I am happy to share. And I can't remember if they're one of the uploaded appendices with the toolkit or not, but I could send that out.
Thank you. Yes, and I'm happy to send out anything as well to the group who attended and then to the larger SNAC group. So fantastic. Thank you so much, Annie and Liz. We really appreciate your time today and sharing more about your project. And like I said, I will send out information to the group, and our SNAC newsletter is coming out next week as well, or at the beginning of May, and the information will be there as well and on the SNAC website. So thank you all so much. And next month's webinar is Social Determinants of Health Screening in Indiana Hospital Systems. So if you're interested in that or have any other community members who are interested, feel free to share that with them. We will put that event on your calendar at the end of this month and share out the Eventbrite within the newsletter. So thank you all so much, and please reach out if you have any questions or need any connections to be made.
Thanks for
Have a great day.
inviting us. Bye.